So this is, again, Project Echo, Care of Older Adults, and the Kentucky Coalition for Healthy Communities. This is hosted in collaboration today by the Lake Cumberland Area Agency on Aging and Independent Living, and we really appreciate their support in today's meeting and collaboration. So a few technology tips. Most of us are probably pretty comfortable with Zoom by now, but if you ever have any issues with your camera or your microphone, there are little icons down in the bottom left-hand corner that you can test your microphone or test your camera if you're having some issues, and that will give you some options to treat it there. If you ever need to call in on your phone, you can call in using one of these telephone numbers and the meeting ID for today's meeting. So I'm going to ask my colleague Mona Huff if she'll talk about the KCHC.
Well, hello, everybody. We welcome you here. And the Kentucky Coalition for Healthy Communities is a coalition that came about from the Kipton Rural Diabetes Coalition quite a few years ago. When that grant ended, we wanted to expand our focus. Thus, we came up with this coalition. And what we hope to do within our coalition is to create community support systems for older adults in partnership with our existing local coalitions and organizations. So we want to work with throughout the state with the folks that are already doing the job and collaborating and seeing how we can work better together. We also want to develop the workforce and concerned community members to empower our communities to become healthier. We really do believe that Kentucky and beyond can become healthier, and we want to be a part in helping that happen. So thank you for being here once again, and we'll talk a little bit more toward the end of the meeting.
Thank you, Mona. And just a reminder, Project Echo started at the University of New Mexico. Sanjeev Arora, as a physician who was treating hepatitis patients, he realized he couldn't possibly treat all of the patients in New Mexico or go out and train all the providers in New Mexico to really care for patients, and realized that Zoom was an excellent way to move knowledge and not patients and really build capacity in local areas. Each Project Echo has sort of a flow that takes specialized knowledge with combining it with case-based learning to really teach best practices of interdisciplinary care. And so we're really grateful to be a part of the Project Echo community here at the Traeger Institute. So it seems like everyone is doing a great job of signing in. We really appreciate that. If you could put your name and anyone with you in the room in the chat and your affiliation, we really appreciate it. Looking like we have a lot of different organizations represented today, and we do really appreciate you being here. It looks like everyone also has a name, but if you ever need to change your name, if you click on the little 3 dots in the upper right-hand corner of your icon, you can change your name there. So we do appreciate that. We do have several representatives from the University of Traeger Institute today. I know that Barbara Gordon is here, and she can talk about services for older adults in the community. I know we have Shelby Jordan here, who is a physical therapist. I know we have a few other members who may be joining late. Dr. Christian Furman will be here representing primary care. And so we really appreciate all of your expertise. And I know that we have a great case today for that discussion. So at the end of today's session, I will launch a poll at the end of today's session. And if you attend, you can receive a certificate for 1.5 hours. We do require you to complete that poll at the end of today's session and indicate that you would like a certificate. So today's Project Echo presenter is Enid Borden. She's the founder and executive officer of the National Foundation to End Senior Hunger. She has worked in lots of organizations, but nearly 3 decades, she's relentlessly led the effort to raise public awareness about and then find solutions to the growing problem of senior hunger in America. Before founding the National Foundation to End Senior Hunger, she was president and CEO of the Meals on Wheels Association of America, as well as serving as the Deputy Commissioner for Policy and External Affairs at the Social Security Administration and Director of Public Affairs for the Office of Human Development Services in the U.S. Department of Health and Human Services. So I really appreciate Enid's expertise in being here today. And I'm going to stop sharing so Matthew can share their screen.
Here we go. You ready for me now, Justin? Great. I want to thank you so much for inviting me to address you today. Are we having trouble with our?
Yeah, wait one second.
I have Matt Levine is next to me here doing the PowerPoint stuff because, as I said to Justin before, I'm not good at that. So, and now we're frozen.
Okay, we're good.
Okay. Anyway, before I begin, I have to tell you that I truly believe that what's being undertaken at the Traeger Institute and Project ECHO is the exact model I think should be replicated all over the country. Today, I'm charged with talking to you about senior food insecurity. It's, as Justin mentioned, it's an issue that I've been working on for over 30 years now. And throughout those years, I've come to understand quite well that we can give people food, but leave them hungry. Their bellies may be full, but they still may be lacking the adequate nutrition they need to help them sustain a healthy life. Food insecurity causes great harm for those who, through no fault of their own, suffer that indignity. Now, much has been written about the causes of food insecurity, and much too has been suggested as possible solutions to the problem. Now, my task today is to talk to you about this in 15 minutes. And at first I thought, well, that's a crazy way of going about this. Why so short a time? I mean, I've been talking about this for so many years, and you asking me to distill in 15 minutes. And the reason that is because if I can't convince people of the insidiousness of this crisis in 15 minutes, then I do a great disservice to all of those who are actually doing the work. But it's not enough just to talk about the problem. We have to talk about the solutions. And that's where I am so encouraged by the work of the Traeger Institute. So let me start where I started. 30 years ago, I was offered a job with a small nonprofit called the National Association of Meal Programs, or NAMP, a tiny organization with an even tinier budget. But I had just left the job in the federal government, and I thought, well, quite frankly, it was kind of boring and mundane. And I'd always thought of working in the nonprofit sector. I thought this was a very good entry point. The organization was comprised of Meals on Wheels programs throughout the United States. The programs that they ran were all nonprofits or part of state and local governments, but they all had the same mission: to provide one usually hot meal to seniors who were 60 years of age and older. And that was about it. The people around the programs are absolutely wonderful people. They care deeply about those seniors that they serve. Home delivered meals are a blessing to the hundreds of thousands of seniors who need them and who have gotten them throughout the years. I loved my work there. But I kept thinking that there were some elements of the program that were missing. Now, I'm not saying that Meals on Wheels is not a great program, far from it. I would go so far to say that the individual Meals on Wheels programs throughout the United States are some of the greatest nonprofit organizations in the world. But not all Meals on Wheels programs are alike. And as with any organization, some are better than others. There were many programs that gave seniors a choice of what they would be served. There were others, for one reason or another, offered a meal that was not exactly the tastiest meal ever served. So too, many of the meals were very high in fat or sugar or salt, but they did fill a belly, and that, of course, is important too. The meals served at most senior nutrition programs, and here I'm talking about home delivered meal programs or Meals on Wheels, and congregate nutrition programs, which are usually at senior centers. They usually consist of a hot noontime meal, usually 5 days a week. Now, many programs are not even open 5 days a week, and therefore they may be serving or delivering meals just 2 or 3 days a week. 9 out of 10 of those senior programs, seniors don't get a choice of what meal they would have. Now, there are certainly federal and state guidelines that dictate what the contents of the meal are, how much protein must be served, usually 3 ounces, and that meal must meet USDA guidelines for 1/3 of the dietary reference intake, and so forth. And many senior nutrition programs do offer meals that may be more medically appropriate. For example, some offer diabetic meals. But are we doing enough to ensure that those seniors who are availing themselves of the services offered by the more than 5,000 Meals on Wheels programs nationwide and 11,000 senior centers nationwide, are they getting more than are they getting those meals? Are they nutritionally sound? I think we do a great disservice if we don't look at the larger picture. We should be looking further than just the meal being provided. We need to look at the health implications of the meal and the other services that are being provided. One of the issues that we're confronting as a nation, well, perhaps we should be, as a result of the pandemic, is the issue of social isolation and the concomitant risks, both physically and mentally, for seniors that poses. And I know that for a fact, as a senior myself, isolation during the pandemic was not easy. It makes me more convinced than ever that if the senior can get out of the home, if they are ambulatory or can get to a senior center with help, they should. Eating alongside someone else is a wonderful preventive measure against social isolation. The very act of breaking bread with someone and sharing a conversation most likely beats eating alone. Now, that's a bit of my editorializing. So let me get back to the issue of senior food insecurity. So let's start with the facts. The numbers. We concentrate on two measures of food insecurity and very low food security, or VLFS. These are based on a full set of 18 questions in the Food Security Supplement, the module which is used by the U.S. Department of Agriculture to establish the official food insecurity rates for households in the United States. Now, food insecurity is defined as 3 or more affirmative responses, and very low food security as 8 or more affirmative responses in households with children and 6 or more in households without children. All VLFS, very low food security persons, are also included in the food insecure category. So, in 2020, out of 76 million persons aged 60 and over, 6.8% are food insecure, and 2.6% are VLFS. That translates into 5.2 million seniors and 2.0 million seniors, respectively. The research has been undertaken by Drs. Jim Ziliak of the University of Kentucky and Craig Gunderson of Baylor University. We were the first organization to have actually funded this research more than a decade ago. We realized that we needed to have more research undertaken in order to really get a handle on the extent of the problem. While we no longer fund the research, Drs. Ziliak and Gunderson are still doing the research under the aegis of Feeding America. Now, the most recent research finds that food insecurity among seniors is greatest among Blacks and Hispanics, and those with lower incomes, those who are younger, age 60 to 69, and those who are renters. On a more granular level, the research tells us that state-level food insecurity rates range from a high of 13.1% in the District of Columbia to a low of 2.9% in North Dakota. Metro-level food insecurity rates range from a high of 13.2% in New Orleans to a low of 2.5% in Minneapolis, St. Paul, and Rochester, New York. The numbers are quite telling. And digging deeper into the issue of food insecurity and its important partner, nutrition security, we find some other figures that must be discussed and looked into. For example, seniors who are food insecure consume lower quantities of key nutrients than those who are food secure. Food insecure seniors' iron intake was 13.3% less than food secure seniors. Food insecure seniors' protein intake was 9.2% less than food secure seniors. Food insecure seniors' calcium intake was 9.7% less than food secure seniors. Food insecure seniors' energy intake was 8.5% less than food secure seniors. So it's not just those seniors who are wondering where their next meal is going to come from. Their health is impacted by a nutritionally poor diet. On the flip side of this, and I would be remiss not to point this out, 74% of adults have overweight or obesity. Poor nutrition and food insecurity is a huge problem. Recent findings from the National Health and Nutrition Examination Study, NHANES, found that food insecure seniors are more likely to have chronic health conditions. 64% are more likely to experience heart attacks. 71% are more likely to experience congestive heart failure. 74% are more likely to experience diabetes. 78% are more likely to experience asthma. And this next one blows my mind. 262% are more likely to experience depression. Our work at Nefesh has been based on this research. It led us to understand that we must do more than just feed clients who utilize the services of those nonprofit entities, such as Meals on Wheels and senior centers. The work and those who carry it out are to be applauded. It's great, but we need to do more. To look merely at food insecurity and seek solutions to mitigate it is frankly just not enough. We in the nonprofit sector need to do a better job of recognizing the coexistence of food insecurity and related diseases and disparities. We need to look at nutrition security and the concomitant issues that are involved in that. The USDA definition of nutrition security is consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease, and in some cases actually treat disease. In the short time that I have left, I'd like to leave you with the words of wisdom of former US Senator Tom Harkin of Iowa. His words are what we at Nefesh are engaged in. We're working on piloting a project in our hometown here in Washington, D.C., which, of course, as the numbers we just discussed, rank worst in the nation with respect to food insecurity for seniors. We're trying to bring a health component to the meal programs in senior dining sites in D.C. We call our project Age Well. We're working with the George Mason University College of Public Health on a research project that brings a healthcare focus to senior nutrition programs, specifically senior dining sites here in the District of Columbia. We are engaged with colleges of nursing to bring nurses and student nurses into several of our pilot sites to do blood pressure monitoring, BMI monitoring, and medication management consulting, etc., to those sites. We're taking a deep dive into the idea of adding a health component to nutrition sites to look at how best we can address nutrition security and food insecurity, while also addressing the health needs of those seniors who are being served at those pilot sites. Let me get back to what Senator Harkin said. He said, fostering the idea of nutrition security is essential to the way we treat hunger in the world. COVID-19 has made clear that Americans who are most likely to be hungry are also at highest risk of diet-related diseases, including diabetes, heart disease, and many cancers, a harsh legacy of inequities and structural racism in our nation. By prioritizing nutrition security, we can begin to break down the long-standing silos between hunger and nutrition, areas that cannot and should not be addressed as unique individual challenges. In order to effectively address today's hunger and nutrition policies, systems, and environments, we must present solutions that tackle diet-related disparities and diseases. In short, and in conclusion, it is our belief here at Nefesh that food and well-being shouldn't be seen as mutually exclusive concepts in the management and functioning of programming and services provided to our seniors. We're trying to do that in the states in which we work. It's perhaps a new way of thinking of doing business. And so we know it's going to take time, but we are committed to the task. I want to again thank you for having us come and talk to you today, and thank you for being so committed to helping us solve this problem.
Thank you so much, Enid. I'm going to put NFESH's website in the chat, or actually, Matthew, could you put that and relevant contact information in the chat? And we have a few minutes. Does anybody have questions for Enid?
Well, Justin, I'll jump in just because I find myself hitting my head against the wall so much. I work with seniors in our area. I have done Secret Santa bags for a number of years at Christmas time for our seniors. And for those folks who are helping me, I just have such a difficult time getting them to understand the importance of putting healthy things in those bags. I finally gave up, and we are giving some chocolate, but I've got a special donation so that I can add fruit. Do you have any advice how we can educate our communities? Because I'm always getting pushed back and being told at that age they should be able to eat what they want. Leave them alone, Mona.
That's the age-old saying. I mean, that's true. However, I think education is the key. I think if they understand, and I'm a senior too. I'm in my 70s. It doesn't mean that I can't eat some chocolate every now and then. Of course I can. But again, it's a process. It's a slow process. But we have to keep talking about the value of a good diet. Doesn't mean you can't have dessert. We know that. But those bags can be put an apple in there. I guarantee you they'll eat that apple too, and they can have the chocolate with the apple. But again, it's a process. It's a slow process, but you know, health is very important. And again, I can't stress enough that filling a belly is great, but filling a belly with the right things is even greater.
Enid, hi, I'm Debbie. I'm a bachelor of social work student in Elizabethtown, Kentucky. And I was curious, what are your funding sources for this program? And I agree with everything you said, and I want to jump up and down, but this is not the time.
Sure it is. It's always a time to jump up and down. I do it every day. The funding, well, it's interesting. We've been very lucky. We get grants from states. We usually work with states, and I'm proud to say that we're working in the state of Kentucky. We've been working in the state of Kentucky now for several years. I'm even developing an accent. Yeah, maybe not. I can't help it. We work with states because if we work on that level and then bring it down, we work with states and then AAAs and then individual programs. We are, you know, during the pandemic, the buzzword was we're all in this together. I'm not sure that we were, but we need to be all in this together. So working with the states and then down to the AAA and then even down to the individual Meals on Wheels programs and senior centers. That's what we do. And we've been lucky. We've been our program in our project in the District of Columbia. We've gotten a grant from the District of Columbia to work on this project, and we're proud of it.
So the AAAs in this context are the Area Association on Aging. I haven't got that.
I'm sorry. Yeah, I sound like I'm living in Washington, maybe because I've been here too long. It's the Area Agencies on Aging.
Agencies. Okay. Yes. Thank you.
Sorry.
Dr. Furmanesi, your hand is raised.
Yes, I'm sorry I got here a little bit late. Maybe you already said this, but you know, I'm a geriatrician, palliative medicine doctor, and really there's been so much well, it's probably always been there, but a lot more talk about how nutrition definitely affects brain health, right? Dementia. Everybody's so worried about dementia. I mean, rightly so. I mean, dementia is a big deal. And I think if you can link some of this eating healthy foods to your brain and preventing dementia, I mean, people will spend lots of money to like prevent dementia. So spending money is eating the right food. So I think that link to dementia is might be a way to entice people to do the right thing.
You're right. Yeah.
So other comments or questions for Enid? I know there's gonna be
Catherine?
time.
Catherine has her hand up.
Catherine has her hand.
Thank you. I'm a Parkinson's expert and board certified patient advocate in Louisville, Kentucky. And one of the things that I work on is working with the caregivers of those that live with Parkinson's. And part of what they're always asking me is about nutrition. And of course, nutrition for Parkinson's is brain health. So I'm wondering if you have any programs where you're going to train caregivers how to prepare and offer meals that are nutritious, but that their loved ones will actually eat.
That's,
Because my husband has Parkinson's. He was diagnosed 18 years ago, and I'm his full-time caregiver, plus I run 2 companies. And I have to tell you that getting him to eat properly, because he is craving sweets all the time, and it's a part of the Parkinson's. So I'm thinking if there is a program that we can develop to teach caregivers how to prepare and what kinds of foods are good for brain health. I do this in my support groups and my education programs, but you know, if we could have a pilot program.
good idea.
We could use the community college if she has the content.
We have a thing that we call our senior-centered community college,
In
and it's our online, we do online training. And that's something I'd love to talk to you further about. I'd love to. You're right, it's great.
And-
Yeah, I can't tell you how many people ask me, what should they feed their loved ones who have these brain diseases and neurological conditions? And so many of them crave the sugar, and it is really hard. I mean, I find my husband at midnight going and getting something sweet to eat, whatever he can find.
And Catherine, are you in Louisville?
Yes, I am.
Okay, good. A couple of things. One is Traeger Institute fully believe in culinary medicine. We do believe that food is medicine, and we also believe that there are a number of things that we can do before as well as during and after a diagnosis to improve brain health, to help progression, et cetera, to not advance. We are hoping in the near future, in early 2023, to open or to have a brain health clinic at the Traeger Institute, but also our culinary kitchen is currently being built out. And hopefully early in 2023, we're going to be having a number of things going on, including teaching medical students, et cetera, that food is medicine, teaching them about the importance of food and teaching our, patients about how important food is. Wanted you to know that is in the future, but those are things that are going on. But I would be interested too in the online program that you were mentioning. So maybe you can share that with Justin, and he can send it out to all of us in the group here today when he sends out his follow-up email.
Kentucky paid for it.
Yep, love to.
Awesome.
Yeah, and I would say our Flourishing Together classes is a really great start in what you're talking about. And as we open the kitchen, hopefully that will even be expanded to meet what you're talking about more. And I noticed Dr. Furman wrote in the chat that, Traeger would really love to help pilot something like this. And I think that's something that we all need to talk about.
I think if you're going to do something like this, though, as caregivers, if you're trying to reach that component, it has to be mostly virtual because it's really hard for us to leave our loved ones.
We love.
And our Flourishing Together classes are virtual, and I can see where cooking classes could be. Dr. Joe has done a few for us on My Health Matters on Monday nights. So yes.
Okay.
I think we can look
I
at those
definitely
kind of
would.
things.
Yeah, I would definitely like to know about that, and then I can teach, because I run support groups both virtually and in person in Louisville.
Okay, sounds great.
Thank you.
Thank you, everyone. Any last questions? There will be a little time to ask questions probably at the end of today's session, but is there any burning questions before we transition to the case presentation?
Really quick, NFESH, how do you say it? NFESH?
Nefesh,
Nefesh. Is it based in Washington, DC?
it is.
Oh, I'm in DC. I'll have to go find you. So
Oh, come find us, absolutely.
awesome.
We're actually in Alexandria, Virginia, right across the 4 miles from DC. Let's get together.
That's where I'm from.
Oh, good. Look at that. It's old home week.
Thank you, everyone. So today, recommendations are going to be captured by my colleague Danelle Beeler. And so now I need to remember to share my sound. Kyra from the Lake Cumberland Area Area Agency on Aging and Independent Living recorded her session in advance. So I am going to share my computer sound. I'm going to mute my. Here is Kyra's presentation.
Hello, everyone. My name is Kyra, and I'm a service advisor here at the Lake Cumberland Area Agency on Aging. And I would like to, let me see here, to share my screen. Okay, so first off, I'm going to explain a little bit about one of my participants that I had the pleasure of getting on my caseload. So the overview of my presentation is the participant had been homeless for over 5+ years. A member of the community lended a helping hand and assisted him with getting accepted into an apartment complex. Participant did not have a source of food until he moved into his apartment complex. Through the waiver program he is now on, he receives mom's meals and he receives those meals weekly. Participant states often that he is very thankful for all the help that he has received. So one of my main questions is, how would you best support a client in encouraging a client to eat his full meal? He struggles with the worry that he will run out and not have food when he gets hungry. Unfortunately, this gentleman was living on the streets. He just lived in the woods, he lived behind buildings, he lived anywhere that he could possibly find shelter. And one thing that he has reported to me was that he is having a difficult time just eating. I know from my standpoint, food has never been like an issue. It's never been a worry, but for him, it has always been a worry for him. And so one thing that he stated was he has a hard time eating a full meal. And I asked him to explain a little bit to me, and he stated that he was always worrying about if he was going to get food later that evening. So he would portion his food. So like for me, and possibly you guys, whenever you go out to eat, you would either get a meal with 2 sides. And so for him, when he first started, he would get a meal with sides and he would eat one thing, and then he would want to save the rest just in case he did not have food. So that is one of my main questions, is to try to get him to see if anybody knows any resources that could possibly help him just get a better understanding that he is safer now. He has mom's meal set up, and we have definitely been encouraging him to eat exactly what he wants, when he wants, and that hopefully that worry will decompress. So a little bit about him. His age is 50. He is a male. His living arrangements now, he lives in an apartment complex. His diagnosis is G81.92 and I63.9, cerebral infarction. His height now is 5'3". His weight is 175. He has recently gained weight. I know previously before the program they stated that he was very small. His blood pressure runs high. I know that he does go to his medical appointments monthly, or PRN as needed. Now, like I said, his living arrangements is an apartment complex, but prior to being on this program, he was living wherever he possibly could lay his head down at night. So the holistic assessment, the participant's education is unknown at this time. He has not shared that with me. The participant is his own power of attorney. He is transported by his PDS employee to the grocery store and to any appointments that he may have. He was very lucky to come into contact with a man of his community, and that man has taken him under his wing, has a great employee for him. I know that the employee helps him with all of his needs, but is also there just as a friend, and they get on very well. I know that the participant reports no use of substances. I'm not sure of any substance use prior to the program. I know that every time I see him once a month or as needed. He is always well groomed. He is very well mannered. But prior to the program, I'm unsure of that. The participant reports mild anxiety and depression disorder. I know that he states that he gets anxiety when he thinks of his past, depression when he thinks of his past. He's very thankful for what he has now, but he states that he just gets extreme anxiety sometimes. Most of the time it's mild. He states that he just lives in fear of constantly having to go back to that. Like I said, no reports of education. Participant is unemployed due to right side weakness and an unsteady balance. He uses a cane to walk around his home. Unfortunately, at his apartment complex, he does have to go up several steps. He states that he just takes his time and goes up and down those steps as he can. The participant lives alone, reports that he has a sister still living, but does not have communication often with her. Participant states that members from his church and community visit him often. He states that he does talk to his sister, but not often. He states that she just was not very helpful and helped him during the situations when he felt like he needed her the most. He states that he does go to church every Sunday, and he has people from that church that check up on him often. Sorry about that. So this is, I put on previously and currently. Previously, before I know that he got on our program, he did not have access to regular source of care. He did not have access to his medication. He did not have access to mental health services. He did not receive care previously, and dental care was not had as well. But now he does have access to a regular source of care. He has access to his medication, access to his mental health services. He says that he is getting great care and wonderful care. And I know that previously, the last time I met with the representative, he stated that he was going to be working on getting him dentures. And he was very excited about that. He states that he often gets embarrassed talking to people due to his appearance because of his teeth. Participants, employee, and representative provide him with those resources. They are wonderful with him. They help any way that they possibly can. And he just states often that he is just so thankful for everyone's help. But I do know that he sometimes gets embarrassed talking about it. So we kind of just let him talk as his own free will. And whenever he wants to talk, we talk. Whenever he doesn't, we don't force it. So with collaboration, the participant receives medical attention from his family medical provider here in Russell Springs, Kentucky. And he also goes to mental health therapy once per week or as needed. I know prior to just recently, he was going to see his therapist more often, but he states that now he just goes once a week for a checkup and just to have that relationship with his therapist. And so this is just a little bit of research that I have done. And honestly, when we think of homelessness, we think of bigger cities. We think of that wouldn't happen here, or we're a small town in Russell Springs, this doesn't happen here. We're wrong. So this took place right here in hometown. He states that there are others that are living that way that he is trying to get in contact with, but has not been successful recently. So therefore he worries about them. But Kentucky is ranked 24th in the United States. Kentucky is the 24th state ranked in homeless. The nearest homeless shelter to Russell Springs is 31.25 miles away. Whenever I talked to the participant, he stated that he was not sure of any homeless shelter. He states that he doesn't think that he would have went due to there being at most places a 30-day period that you could stay. He stated that he just tried to live the best he could off of whatever he could. He would eat when he could, he would sleep when he could, but he just did the best that he could. So now these are the statistics with hungry and eating. 1 in 8 adults faces hunger. And most of the causes that we can think of is poverty, lack of affordable housing due to housing increase. You know, they don't know whether to pay their bills or to buy food. So therefore, lack of affordable housing can also cause an increase in hunger. Chronic health conditions. So maybe if someone doesn't get insurance and they're having to pay for medication, they may not have the money for the food. And then Kentucky is in the top 10 highest food insecurity state. I think that is just mind-blowing. You know, you don't think of, well, it's just food, you know, we'll figure it out, we'll get it. Some people don't have that help. They don't have people to talk to be able to get food. So therefore they're living day to day, or I should say meal to meal. So in the big scheme of things, thankfully this participant was able to find help. He was able to reach out and get the necessary help that he needed to survive. So we are very thankful for that. We are thankful to be able to serve our communities. And one thing that keeps me worried is the people that aren't able to find resources or to find help in their communities. You know, where are they living at right now? Or will they get a meal tonight? Or are they still eating on that cheeseburger that they got several days ago because they're worried about where their next meal will come from? So thank you all so much for listening to me and letting me share part of what I do on a day-to-day basis with all my participants. But thankfully I was able to meet this gentleman, and I'm super excited to see where we can get him to one day, because he is so thankful and I love getting to meet with him once a month. So thank you all very much, and have a great day. Thanks.
Thank you, Kyra. And so, Kyra, do you have any questions before we start talking, or is this
No, I don't have any questions.
okay? So we appreciate you being here, and we appreciate your going over the case and your enthusiasm for really supporting this person. So team, what stands out to you? I know that Enid's been putting some resources in the chat. But are there other things that stand out to really help?
I have a question, Justin. Kyra, and you may have said it, but I might have missed it. Did you talk a little bit about what matters most to this patient?
So he just really talks about how he's constantly worried about not having this resource forever. He continues to say that he's just worried that he's going to lose his home, or he's going to lose the help. They're going to get tired of helping him. So really, he's just thankful for the community that he does have, because he isn't losing what he does have.
Right. Okay, good. Thank you.
This is Debbie. I was curious, how long, so was he homeless for how long before you got to meet him?
From what I have been told, it was 5+ years. And like I said, sometimes he'll talk about it with me, and then the next month I meet him, he just doesn't want to talk about it at all. So we kind of play it how he wants to. I just try to be a resource for him the best that I can whenever he feels comfortable sharing.
And what is the facility or the program that he's in? You said PDS?
Yes, that's the participant directed services waiver.
Okay. And then is there any chance of him losing it? Is he fully aware what the requirements are to stay in the program?
Yeah, he is. He has a wonderful representative that communicates with him well. So even though he has a representative, his rep really talks with him about every situation that takes place.
Okay. So is it an ongoing permanent program that you can stay as long as you need to?
Yes.
Okay, all right. So that's one thing. So what I was thinking the most is that when you're in such a situation, it's PTSD or just that fear is going to stay probably for close to 2 years until he knows, because that grieving process, that horror, or that, everything to do with being out of a situation that you used to be in, it takes that long time for that to slowly dissipate. And then there'll be triggers where he thinks that that's going to happen again. So it's very natural for him, of course, to feel that way. And just that reassurance, and maybe having somebody talk to him that used to feel that way and it's been there for a couple more years to say that, yeah, I barely think about it anymore. It sounds like there's awesome supports already set up for him. He's in therapy. He's getting to eat well, so it's just going to take time. There's no magic that's going to make it happen faster.
Okay, thank you.
Other questions, or something that stood out to me, kind of what dovetailing off what Debbie was just asking is, does he have access to mental health therapy or is he interested in that?
I know that he receives therapy. The last time that I had spoke with them, they were going to get him more involved in group therapy. So maybe trying to link him, like she said, with other people that have previously been in the same situation that he has been in. They're hoping that will help him.
But you had said that he's going to a therapist once a week and he used to go more often. Did I understand that correctly?
Yes, correct. He goes and sees her. And like I said previously, sometimes he wants to talk and then sometimes he doesn't. So just getting that one-on-one contact and making sure he feels comfortable before they put him in group.
Enid, I'm wondering if you have encountered this before, where somebody has experienced food insecurity and then once they have stable access, is this something you've had experience with or have seen?
Yeah, I think that, the interesting thing for having been in this field for so many years, one of the areas that has not been addressed as it should is the issue of homeless seniors. You talk about I always talk about them as the forgotten hungry. That is a segment of society that we have been ignoring. We cannot ignore that. We've got to address it. We've got to figure it out. Again, we've got to do it together. And it's community by community by community. I applaud what you're doing. God bless you for doing what you're doing. We here in the District of Columbia have a very large homeless senior population. We've been doing some work with Catholic Charities about this. Much more needs to be done, but again, the first thing we have to do is notice that it's there, that these are people who live in our communities, that are our brothers and our sisters, and it is incumbent upon us to say we can do something about it. We have an obligation to do something about it, and it'll work. Once we get them into a system, whatever that system is, it will begin the process of healing, and that's what it's about. Food heals.
So other questions or thoughts? Catherine, I see you have your hand up.
Yes, I was gonna dovetail on what Debbie said. The peer counseling, getting someone else who's been in the program should help slowly change the habit of fear. because the fear of losing something that's keeping you alive is overwhelming. And I think if you take step by step, you know, a little bit at a time, hopefully he'll develop this habit of, it's okay if I eat the full meal. It's okay for me to not worry about losing the opportunities that I have right now. And so the peer counseling can really help. I know my son went through peer counseling when he was just 13, when he was being beaten up in school. And it really made a huge difference for his life. So peer counseling can really make a difference.
Mm-hmm. Excellent.
There's another, you had mentioned some statistics about homelessness and poverty, and from Bridges Out of Poverty, which is a program with AHA Process, they have a lot of materials on that. But I learned in my research that for a community to realize that there's poverty, it has to get close to 24% or so in the area. But once it gets to that, then it's, of course, even harder to take care of. So here in Hardin County, we're like at just below 10% or 9%, and it's higher in a couple counties around us. And so it has to come from people who are aware to let the powers that be know, because poverty and homelessness are very related, of course, but it does stay under the radar until it gets up past 20%.
Mm-hmm.
The chat had some interesting Housing and Senior Resources Center, the Senior Center Community College, which was before, but just want to make sure people are looking at the chat. And then Mona, do you want to ask your question?
Well, you just mentioned there's been a 90-pound weight gain in a fairly short period of time. And I'm just wondering, do we have a reason for that? Is he just trying to eat everything, thinking that he may not get more? Or do we have some issues with congestive heart failure or kidney failure or something like that?
I'm not sure that it was a 90-pound weight gain, but I do know that he gained several pounds.
Okay, I thought I heard you say that.
So he did gain weight, but he kind of went through a period where he was hoarding the food that he did have. And so I think there was a little bit of a barrier there between him and his employees and stuff, and he was hiding what food he did have, so they would go get more for him. And so then once he began to feel more comfortable and not feeling like he was living in fear as much, then he started to slow down and kind of start eating, you know. So yeah, he kind of knows how to portion a little bit better now because he's feeling a little bit more comfortable, but there's still that constant fear.
I want to acknowledge, Sara, do you want to talk a little bit about the resources you put in the chat and how that might support Kyra?
Yes, definitely. And I I didn't want to divert because they're not nutrition specific, but I did just want to mention the Housing and Services Resource Center. So one of our major funders is Administration for Community Living through the U.S. Health and Human Services. So they are part of a collaboration with HUD as well. And I just wanted to make sure people knew about this. It is new-ish. It's new within the last year, I believe. But there's a Housing Service Resource Center. If you click around on it, you know, it's certainly with the elder care locator, you know, a national call center, and anyone who's, well, it sounds like everyone on the call. We're experiencing a huge uptick in older adult homelessness. And this is part of a attempt at a beginning of a solution to really try to get the collaborative partnerships going, and highlight resources and make it a little bit easier to find resources where they exist, knowing that that is a really big deal, that a lot of times the resources just don't exist or the housing stock just simply isn't there. So I didn't want to divert too much attention from the nutrition piece, but I know we're all grappling with the, you know, homelessness piece as well. This is one resource.
And I'm hoping, Kyra, that you can maybe talk a little bit about the consequent, or like what his diagnosis, the cerebral infarction, and how that might impact his day-to-day living, and maybe how you're supporting him around that. You're on mute if you're speaking.
Thank you. Honestly, I'm unsure about the medical standpoint of his diagnosis. I do know that he did share with me that his right side weakness was from a fall that he had several years back. And then he never went and got the medical attention that he needed. So I don't know, like if there was a break and it grew back like that, or what exactly happened. But that's what I do know.
And so, Shelby, are you available to maybe talk a little bit about how you could support, or how you would support this patient?
Yeah, absolutely. So I'm a physical therapist at Fraser Rehab here, and I think just kind of looking at his whole picture, one of the most important things that might be motivating for him in order to eat more would be to assess. You said he had a lot of stairs that he's going in and out in his apartment. So assessing his ability to do those independently. And if he's having a lot of trouble with that, that might be a motivating factor to say like, hey, you know, in order to build muscle, in order to get stronger, you have to have the right nutrition. You have to have protein, and you have to have essential things in your diet to kind of encourage him to do that and to get stronger in those ways that he's, you know, that way he can go to church and be more mobile and do those things successfully. So that might be another motivating factor to get him to eat a full meal, definitely.
Yeah, he's really good with communicating when he feels comfortable. So that's like one thing. He has the rail on one side and then he has his cane on the other. So he really just takes his time going down. And then that was, of course, a safety issue that we had spoke about. And he's very motivated. He wants to do better. He doesn't want to rely on people because he constantly feels like they're going to give up and quit helping him. So I do think he's really trying to get back on his feet. It's just taken a little bit.
Sure. And physical therapy sounds like it might be something, if he has, you know, capability to get into physical therapy, if he's looking into that, that would be very good for him as well.
Yeah.
So we do have a few minutes. Any additional comments or suggestions for Kyra? Or Kyra, do you have any questions? So Julie is also a physical therapist, and she put in the chat even home care physical therapy.
Mm-hmm.
Yeah, that home health therapy might be another option, just to be able, that way he doesn't have to. And it depends on how able he is to move around. Sounds like he's at least getting in and out of the house relatively well, but as far as access to care and coordinating transportation and all of that, it might be easier to have someone come to him as well.
Mm-hmm.
Okay, any closing comments before we transition to the
I did want to ask one more question, Justin, if that's okay. Kyra, does this individual have a lot of social connections? Like, is he able to go to senior center or any outside programs other than be at home?
Am I unmuted? Yeah, can you hear me? Okay. So he does go to church often with his representative and employee. I've mentioned senior center. I've mentioned, you know, if he has more friends in the apartment complex, and it's just a little bit different because in his mindset, he's already been an outcast. He doesn't want to draw more attention to him. He kind of wants to slowly get back into the community. He doesn't want to be like, because unfortunately, sometimes people are rude. They're like, oh, that was that homeless guy, you know, and so he's really trying to slowly get back into things. But he said maybe in the future, he's got some friends at his apartment that he feels comfortable talking to with. So we're kind of just letting him do as he will right now. We don't push too hard.
Well, another potential resource, something that, he might be interested in, may be comfortable with, is we do have a virtual friendly visitor program. And this program is accessible to anyone in the state. It doesn't matter where you live because it's virtual, right? And we utilize our students primarily, but also volunteers to do the actual friendly visiting. We also have tablets that he could access if he doesn't have a smartphone or his own, technology to make the connection. And then our volunteers are also trained to teach them how to use the technology and how not only to connect to Zoom to do the friendly visiting, but also to make additional connections, social connections, like through social media or video conferencing with others, connecting to groups, even in the community, who are still doing virtual connections, et cetera. So if you're interested in maybe, talking to him first, obviously, but if you're interested in learning more about that program and possibly referring him, you can contact me, Barbara Gordon. I'll put my email in the chat.
Thank you, Barbara. Thank you, Kyra, so much. Matthew and Enid, thank you so much for being here to represent the National Foundation to End Senior Hunger. We really appreciate it. Now we are going to transition to the Kentucky Coalition for Healthy Communities.
Okay, so we're going to get started with our meeting, and if you'll go on to the next slide. Our purpose is to train and empower stakeholders and community members to provide hope and education for their communities. And we're hoping that as we learn, as we have today, we find ways to be able to get this information out to our collaborative partners and our community members.
Thank you. And now I'm going to ask Barbara Gordon to talk about some of the services that are happening at the Lake Cumberland Area Agency on Aging and Independent Living.
Yes, thank you. So we are just so excited and appreciative of Lake Cumberland Area Development District, Lake Cumberland Area Agency on Aging and Independent Living, partnering with us today, engaging their own community and region to participate in this Project ECHO, and thankful for Kyra presenting the case that she did. I think it really gave us opportunity to have some rich discussion about the diversity of patients and clients that we serve every single day. So I really appreciate that. I'm just going to share with you all some of the services and programs that Lake Cumberland provides. As an area agency on aging, they're supported and funded through a number of federal and state funds. The area agencies on aging exist throughout our country, one of the best held secrets in most of our communities, but it is one network that needs to be sounded from the cloud, so that those who work with older adults, especially in people with disabilities, just generally know a resource that's rich in helping to connect the people that we serve to services and programs that can help them to live in the community for as long as possible. In Lake Cumberland Area Development District, it serves the Lake Cumberland area, which includes Adair, Casey, Clinton, Cumberland, Greene, McCrary, Pulaski, Russell, Taylor, and Wayne counties. That's sort of like southeast central Kentucky, if I could put it that way. But it does cover quite a large geographic area in our state. There are 14 other area agencies on aging in Kentucky, just for your information. So every county, all 120 counties in Kentucky, are served by an area agency on aging. They serve as an aging and disability resource center. The ADRC, which is the acronym that we use for Aging and Disability Resource Center, is a resource to help the elderly and disabled, as well as their families and caregivers, to find services and resources to keep them living well and independently in the communities of their choice. These, the ADRC, anyone, whether you're a professional, a physician, a citizen in the community, or the person, the older adult or person with disabilities themselves, can contact the ADRC for assistance. They provide a lot of aging and independent living programs, including in-home services such as personal care, respite, home delivered meals, home repair, chore and escort, which is transportation services. They provide home care and Title III services that includes assessment and case management. Community services such as ombudsman, legal aid services, SHIP, which is the state health insurance program, which helps individuals with Medicaid and Medicare access their insurance appropriately, and other entitlement services that they may have access to, benefits counseling, senior center services, and the caregiver program. Participant directed services, which Kyra talked about earlier, is Medicaid waiver services that are provided to individuals through a participant directed model. Home and community-based services are available throughout the state. They can be provided through a traditional model or a participant directed model. Traditional case management and attended care. This is home and community-based waiver recipients to assist in creating the person-centered plan and ensuring approved services are provided. The case manager provides monthly contact to both ensure satisfaction and verify compliance with care. And attendant care services can be provided to home and community-based waiver recipients by agency staff to satisfy goals and objectives noted on the approved person-centered plan. And they also provide veterans-directed care. The veteran-directed program offers veterans and their caregivers better choice and control over the long-term services and supports that help veterans live at home and remain part of their community. Veterans enrolled in the Veterans Direct Care program can decide for themselves what mix of goods and services best meet their needs. This includes the ability to hire, schedule, and supervise their workers while managing them as an employer. This program is developed by the U.S. Department of Veterans Affairs, Health Administration, and U.S. Department of Health and Human Services Administration for Community Living in 2008, and is currently offered at several VA medical centers across the country. All veterans, regardless of age, who are enrolled in the VA healthcare system and meet the clinical need for this service are eligible to participate in the Veterans Directed Care program. Those are many other programs and services that Lake Cumberland Area Development District Area Agency on Aging and Independent Living provide. So thank you. And if you have any questions about any of those services, I'd be happy to answer them.
Does anybody have any questions?
Well, this is Sara. I would say that was an excellent overview. Thank you so much, Barbara. That makes my job a lot easier.
You're welcome.
So if there aren't any questions, we're going to transition to our Kentucky Coalition for Healthy Communities presenter today. Sara Tribe Clark is going to present on 2 national call centers connecting older adults and people with disabilities to local resources. Sara has been with U.S. Aging since December of 2019 when she was hired as the director of the Elder Source Locator. Sara has nearly 20 years of experience in the fields of aging and disability services. In her role at U.S. Aging, Sara oversees the operation of the Elder Care Locator call center, ensuring responsive connection of 400,000 plus people per year to local resources, helping older adults with people with disabilities remain independent in their communities for as long as possible. So thank you so much for being here, Sara. And I will advance your slides and just take it away.
All right. Well, thank you for the introduction. This has been an awesome discussion so far. I feel like I'm in the right place. And hopefully many of you have already heard of and used both the Elder Care Locator and Dial. But if not, and even if so, hopefully you'll learn a few things today. The key purpose for this is I really want to make sure you've got 2 critical resources in your personal and professional tool belts that really can help you connect with older adults and people with disabilities to the resources they need in any state or territory of the US. So I'm the director of the 2 national call centers we'll be discussing, and I work for US Aging, which is the National Association for the network of area agencies on aging that Barbara so nicely laid out across the country. And those are the key organizations that the Elder Care Locator connects to. So, and our members, the area agencies, really, they help older adults and people with disabilities throughout the United States live with optimal health, well-being, independence, and dignity in their homes and communities. And I think the programs that Barbara laid out certainly show that. And I guess if you just go back one slide, Justin, to slide 2, that's around where I am. Just so people have my info up there. Feel free to email me if you've got questions, but more specifically, for the 2 national call centers are both funded by the Administration for Community Living, which Barbara also mentioned, and administered by US Aging. And I guess now we'll go to the next slide. And starting with the locator, best known as a national INR call center. It's based in Washington, D.C. and is staffed by about 20 information and referral specialists and supervisors. So I know several of you are here from other area agencies on aging, aging and disability resource centers, entities that have these information and referral programs that are so critical to connecting people. And we are one of those. It's more on the national level. We don't get quite as in the weeds on the calls, but we certainly are familiar with and are in fact an INR information and referral team. So just a little bit about how the locator works. And now I'm on the next slide with the, so when a caller from anywhere in the country reaches an elder care locator specialist by phone, live chat, or email, we have a conversation with them to figure out their unique set of needs. Email, it might not be exactly right back and forth, but we do have back and forth to really help solve people's, even their emailed needs. So we use our database, which we use the database, both the external one that you can find on the Elder Care Locator site, we'll touch on that too, and also an internal listing of resources that are not on the database, but for example, Parkinson's Foundation or Alzheimer's Association. We have a huge set of resources that we can provide along with the area agency on aging, sometimes state unit on aging, depending on the caller and what they need. So next slide. We generally receive actually over 400,000 contacts per year, as Justin mentioned. It breaks down between 26,000 to 36,000 contacts per month. And this is from every state and DC, US territories. And we can be contacted by phone, email, live chat, and then here on the slide are our hours of operation. So it is, actually we just updated these in November and I neglected to update them here. So we're now 8 a.m. to 9 p.m. So we've added 2 hours of operation to be more accessible throughout the day. So next slide, the profile of our most frequent caller is a female over 60 years old and a person calling about their own needs. So about 12% of callers are from daughters calling about an older adult in their lives. And we have loads and loads of data, which I'm happy to provide if you're interested, but just a little piece of info. And for any of you, many of you are interested in data and know that equity is a major concern and issue. Always, but especially now, we have added a whole new set of demographic questions very recently. So our data is going to be much more comprehensive related to our general caller. And we are now asking people to self-identify their gender, preferred language, whether they identify as having a disability, if they're a member of the LGBTQ community, and also their race and ethnicity. So we've been doing lots of training and work with our team, many months in the making, but we've launched and we'll be getting much deeper, a better, deeper dive into data around our callers and where we're reaching in our target audiences. So on the next slide, this pie chart reflects 12 months of call documentation. It is to give you a snapshot, and for anyone working in this field, I'm sure this list, and probably even the order of the list generally, is probably similar to what you see. But the most calls we receive for the locator are related to transportation. And then also questions about in-home services are our second most frequent call. So in-home services, things like help with meal prep, showering, grocery shopping, home delivered meals, that makes up the next group. Housing has steadily risen in the call. And if you talk to a specialist, they probably would say housing is first. The data doesn't quite show that, but I think just the volume it has increased so much for housing related calls. And that could be homelessness, it could be need for rent assistance, mortgage assistance, all kind of calls related. And then other frequent call types include people seeking assistance with Social Security benefits, long-term care, legal services, and so on down the line. All right, so not everyone wants or needs to call or live chat with us. But they do want the information. Our call center is designed to assist members of the public who are seeking resources or need a starting point. And this is often the preferred method for professionals seeking quick contact information outside the area that they or you normally cover. So going to our website, it's noted on the slide, eldercare.acl.gov. And people can access this comprehensive database that our specialists use on pretty much every single call on their own. So they can get connected to local aging and disability resources. The slide has a red arrow pointing to the space that you can put your zip code or state and town. The town has to be, or the city has to be spelled exactly. So it's best if you know the zip code, but I highly recommend, if you haven't used this, even during the call, go ahead on there, put in your zip code, make sure your organization pops up. Normally it's one that people recognize. Certainly let me know if there seems to be any errors. We can get those changed usually within the day. And let's see, yeah, this is back to that professional tool belt and personal tool belt. If you mention that you work with older adults or are interested in the field, if you haven't already, you start to get questions about resources for someone's grandmother, someone's mom, and it's so critical to have this at the ready because you don't have to give them just Elder Care Locator. Contact the Elder Care Locator, Google it. No, go on our website, put in the zip code, give them the phone number to the AAA, and that is how you get them connected immediately to services that they need. And it could take you 30 seconds and they'll think you're amazing. You will be amazing. All right, so next slide. This is a listing of the resources that you will find on our website. And I've highlighted in red the information and referral and assistance, since if you sometimes people get a little overwhelmed. They're like, oh, there are so many resources. Which one do I choose? Always look for the top one, top number. Information and referral is where you're trying to get people. And they will be able to connect folks once they've talked to them to any of the other resources on here. But then again, if you know the person needs, elder abuse prevention or long-term care ombudsman, you go in knowing that, you can scroll down and just find that number. A lot of times they're all run by the Area Agency on Aging. So you might have all the same number throughout the whole listing on the locator. So just, check it out. Make sure you see information that you recognize, especially if you work with an Area Agency on Aging. All right, next slide. So we've just launched our Home for the Holidays annual campaign. So every year we choose a topic to help start sometimes difficult conversations among older adults and family members during the holidays. And then we provide information on how to get connected to local resources. This year's campaign focuses on encouraging older adults to volunteer, which of course, this is a great way to get engaged in the community, improve overall health, provide needed assistance to others through organizations that have experienced a significant decline in volunteers throughout the pandemic. So it's, some folks are not ready to get back out there. but there's so many ways to volunteer, as you probably know, that now there's, online options sometimes, or friendly visitor phone calls. So the campaign each year includes a brochure. You can see there's a picture of the brochure this year, the front cover. So it's called Ready to Volunteer, Now What? A Guide to Giving Back for Older Adults. So this can help older adults learn about the benefits of volunteering, the types of opportunities, and then actually find how to connect with a volunteer opportunity. And we've partnered this year with AmeriCorps Seniors, and there's some information on that in terms of finding opportunities through them. And then also we try to guide people again to their area agency on aging and Title VI Native American programs to help people find opportunities that they're most interested in. So we also have a toolkit along with the campaign each year. And so the website noted on slide 10, it's our US Aging website /H4H 2022. So all the materials will be listed there, current and up to the minute. Our brochure is almost out. When Justin asked me about this, I was like, surely it will be out. I think it'll be about another week. But along with the brochure will be a whole toolkit for organizations to co-brand. So there'll be space on the back where organizations, whether it's an area agency or other community organization, can print the brochure along with your own organization's info on the back. And that's the point. We're trying to drive people to, not always to the locator to get to you, but directly to AAAs too. I apologize, I'm fighting a bit of a cold today. All right, and just some quick examples of past holiday Home for the Holidays topics. And this is as much to say, you can go on our website and pull these, volunteerism, etc. That's going to be an evergreen topic. We have that and other past topics up on our website. We have a whole resource section with brochures that are printable. So please feel free to seek them out. I just put a few examples: living well with dementia in the community, caring across the miles for long distance caregivers, and then staying connected and healthy during the pandemic, which does have a volunteer section or recommendations for how to find volunteer opportunities. But that pandemic related Home for the Holidays topic was all about helping decrease or increase social engagement, which of course has gotten more and more popular, but it's a concern and issue that's always been there. So let's see. Oh, that's it. Yep, next slide. So our contact information for the elder care locator, again, we can be contacted by phone, email, and live chat. Coming soon, even I think within the next 2 weeks, we will be going live with texting, and in January, we'll have video chat capability for ASL users. Instead of having to go through an interpreter, we'll have direct, people can use their video phones to connect directly with a specialist who's using ASL. American Sign Language. All right, moving on to Dial, and I look forward to your questions. I hate to rush, but I know we want to get all the information out, and then I'll take any questions at the end. All right, so the Disability Information and Access Line. If you did know about Locator but haven't heard about Dial, you're not alone. We are just working on launching a whole marketing campaign. We started up very, very quickly during COVID. So it's an ACL funded call center. And back in March of 2021, President Biden announced an additional $100 million allocated to the Centers for Disease Control and Prevention, CDC, to support the efforts of the Aging and Disability Networks. So the CDC and the Administration for Community Living developed an unprecedented partnership where CDC provided a lot more money than ACL was used to, and then in turn provided that to some of it to us to start up the first national disability call center. It's definitely at first and even now very much focused on getting information about COVID-19, first vaccination, and then mask information, and then boosters and testing and all the up to the minute information that the CDC has. We train up the team on and pass on that information to callers. But it was also created with the idea of also having a hub for helping people with disabilities access independent living resources. And that is something that has never been done. Many of you work with the disability community. There is it's a network that is varied and vast and hard to distill into a national call center. So if we go to the next slide, you will see our initial disability partners. Disability organizations listed on this slide have helped to make DIAL a reality. So the Elder Care Locator and US Aging brought the call center expertise to the table, and we pulled in many disability organizations quickly to say, we need to make this applicable to people with disabilities. We are not the experts on this. Please partner with us. And they did. And they said, this is a great idea. We want this to happen. So from the naming of the center to training up our call center specialists, developing quick reference scripts, advising on where we should refer people for different COVID reasons, and then different independent living concerns, and using our protection and advocacy system in each state to help if there was questions, justice issues or any kind of access issues for COVID vaccination and other things. And then of course, promotion to help us get the word out about DIAL to the disability community, and a feedback loop for, if we weren't getting it right. The Centers for Independent Living had a lot of feedback and were super helpful. We really needed to make sure that there was no sense that DIAL was replacing anything local. We were a conduit to get people to the local resources. So that was messaging that our disability partners really helped us out with as well. So moving on, quick snapshot of the contact volume for DIAL. So since May of 2021, we've helped out over 60,000 contacts through the different ways of contacting us. And it's an average around 800 calls or so per week. We have a huge uptick during the Social Security COLA letter, December through March period. And then our usual calls outside of that time are around 500 per week. But we're really working on different marketing strategies to get the word out more and get more and more people aware who may need our help. On the next slide, just a few of our top reasons for contacting DIAL. The first two bullet points are related to COVID. Far and away, seeking in-home on-site vaccination has been the top call, followed closely by access with assisting access to vaccinations and booster shots and testing. And then other reasons, which have sometimes come in concert with the COVID question, but oftentimes not at all, benefit access and connection. So Social Security and other benefits, housing options has been a huge question that we've received. In-home services, health insurance, financial assistance, and nutrition services is right up there as well. All right, next slide. And we are most likely to refer then to Centers for Independent Living. Area agencies on aging are a big referral for DIAL as well, because the majority of callers, over 65%, have been older adults or 65 or older. We are hoping that with the addition of the texting option, the live chat option, we may get a slightly different distribution, but at least since phone calls were the main way to contact us initially, that may be part of the reason, but we'll see. All right, and then moving right along, marketing materials. I'm just going to give a few quick examples and let you know how to find them. But we are working hard on distributing postcards. We have infographics, social media toolkit. Feel free to use and post our graphics anywhere that is helpful in your own social media. Let's see. Yeah, the next slide just has a few quick examples of the social media toolkit and then graphics within that toolkit for sharing. And the toolkit just goes through lots of Twitter posts, Facebook posts, different like newsletter suggestions, different ways of posting the information about DIAL. And then on the next slide, if you'd like to help spread the word, we have our Twitter and Facebook handles, as well as the website to find the materials. Feel free to print anything. They're PDFs that are printed on, I think, normal size paper. The postcard might be a little different, but probably most of you aren't trying to send postcards. But once you're on that DIAL Connect page under US Aging, find where it says outreach materials, and I'll put it in the chat after. But if you want to access our materials. All right, and then DIAL contact info. Feel free to reach out. Again, if people are trying to reach us through their video phone using ASL, they can connect either just by calling our regular DIAL phone number, or on the DIAL website, folks can find both live chat option and ASL Now. And texting is also available for DIAL. Texting and phone, all with the same phone number. All right, so I will wrap up there and take any questions.
Thank you, Sarah. Does anybody have any questions?
And Justin, thank you for posting things. That's really helpful. The various links and things. I'm going to post a link that goes directly to our outreach materials, in case anyone would like that.
And at the end of later today, I'll send out your slides as well, so people will have access to them after the session. So yeah, thank you so much, Sarah.
Sure, thank you.
Yeah, several people are chiming in. This is really good, and they'll share it with their groups. And thank you for the resources.
Hey.
So any specific questions? I think hopefully during the KCHC conversation, that's, you know, as we talk about how we're going to apply this, I mean, I think that's where the questions come up for me. I will say that when Barbara and I present to our students that we work with in the university, many of them have never heard of the area agencies on aging. And we always talk about the elder care locator, because it's like so many people are coming from around the country. It's really good to reiterate that it's not just in Jefferson County and KCHA, which serves our area, but you can find it anywhere.
Yes, and what an amazing network. And people always have a older aunt, uncle, grandparent, from all over the country, or friends, family who do. It's like, I don't think I've ever met anyone that doesn't eventually have a need for a AAA. If they don't currently, they will.
So if there aren't any specific questions, I am going to turn it over to Mona. And
thank you, Justin, and thank you so much, Sarah and Aiden. Both of these presentations were just excellent. And you don't find me without words often, but I am just so excited to hear and to learn so much more about our resources. I am one that I actually put on every presentation I do something very similar to what you did for the elder location, because we do meet people from all over. And I've had family members call me from different states and say, I hear what you're doing. How can I, get into something like that, and able to share with them that this is something that we have for everybody in the United States, and at least to call and find out what they may be eligible for. And not to assume that they're not eligible. That's another thing. So often people will think, I've got a little bit of something, so I'm not eligible, or let's save it for someone that needs it worse. And we just really need to kind of get rid of some of that thinking too, and make sure that everyone at least understands what's available and talks to someone. So what we want to talk about a little bit now is just to kind of summarize what did we learn? And as Justin said, how are we going to get this out to our communities? And who are we going to share it with? And so I'm just going to be quiet for a moment and give you a chance to either unmute yourself and speak, or Justin will be watching the chat if some of you want to put something in. But what stood out for you today in either one of our talks?
Catherine.
I have to say that when I was listening to Sara speak, I made a ton of notes because the folks that I'm connected with are senior providers, senior living facility staff, because I do support groups at different senior living facilities. I do virtual training. I have so many ideas, but there's a group that I belong to that you all may not know about it in Louisville. It's the HSPN, Health Services Providers Network. That is a monthly networking group. And if you're not connected, you need to be connected. There's over 600 people. It covers Kentucky and Southern Indiana. Additionally, there was a group that I was part of called Aging in Place program that they were working on before COVID hit. And I have not been able to get back to that group, but they're looking at all of these areas of how can we prepare for the future. What is it we're doing in housing? What are we going to do in healthcare? What are we going to do in connecting up groups? And I don't know if you all are connected with the Aging in Place group, but that's another group that you want to definitely connect with. I believe they're still meeting. But the HSPN definitely is a group that will share this information. And I'm going to their meeting. It's the third Wednesday of every month. And
Catherine, if you could share contact information for the health group that you were talking about, that would be great. Familiar with the Aging in Place group, want to also share that for Louisville, there are several other cities in Kentucky as well who are certified as age friendly. And that doesn't mean that they are, actually age friendly, but they are working towards, they have a conscious effort to always move in that direction. And the only reason I bring that up is that there are so many different groups out there. One of the things that I think is really important, especially at this juncture where we have such an exponential increase in the number of older adults in our communities, and that's going to continue to grow over the next several years, is for partnership. We need to come together more. There's so many different groups doing the same thing. And I think if we bring knowledge and information and resources and people together, working together, that we can get a whole lot more done. So if you can put your resources in the chat, we'll make sure we share those, but also at Traeger Institute, we'll try to reach out and contact and see how we can work together and collaborate together.
Yeah, the HSPN group has been going on for a number of years, and it's grown and grown and grown. And it is literally doctors, therapists, most of, Fraser, Norton, PT, you name it, anyone that is connected with the senior provider community, including me. And it really is.
Both of those groups have been around for a very, very long time.
Yes, yes. And I think the other thing, you all may not have known about this program that I worked on many years ago, the Benchmark program. It was the Benchmark 2000. It looked at the security of women in our community and women and girls. And it was something that really opened the eyes, I believe. I'm not sure where it went, but the information that came from that, I think, really showed us that if we don't take care of women, we are really going to be in dire shape. Seriously, not just senior women, but all women, because we are running the communities and we have to find a way to make sure that they are secure in not just not just as, I mean, I'm looking at this as a caregiver. I'm 67 and I've been a caregiver for more than 18 years. There is so much that I have learned over the years that I want to share with folks about being a caregiver, but also about how to prepare someone to be a caregiver. And I believe that's a big part of what we have to be looking at because our population is aging. And because we actually have a pandemic now on its own with Parkinson's and neurological conditions. So those are my thoughts.
Okay, anyone else got some thoughts?
I want to share just a few things that were put in the chat, and some of these are kind of related, but something that stood out to Sarah was that there's so many resources out there that they didn't know about. Kiara was, shocked at how the percentage of older adults that are depressed. Taylor, kind of similar to Sarah's comment, didn't know about many of these resources, especially Dial. And then Stasha kind of chimed in that basically sharing resources on social media is really helpful. I'm going to say for myself, I did advanced care planning with my family about 5 or 6 years ago, and we're going to revisit that over the holidays. And I'm going to have my parents contact their area agency on aging just to make sure that, they're getting all their needs met, and, things that fall outside of what I'm, not capable of helping with. Misty, you put in the chat, she would love information on joining the Aging in Place group. So if you can get those resources in the chat, or if you can connect, that's, would be appreciated. Any other comments or questions or ways you're going to share this information?
This is Sarah. I was scrolling through the list of participants, and it's so heartening to see how many students and interns and people who, I'm recognizing that in every conversation that I have heard that's more of like national level, we hear ACL talking about focus areas and things. Like the workforce is in such dire need of people. And I know that that group that you just mentioned related to the healthcare, is just, HSPN, health service partner. I know that that's been something that I'm sure you must be talking about, where to find workers. We might have all this funding and all these great programs, but who's doing the work? And then AAA directors saying, we've never had such a shortage of staff. So I know when I was in school, there was just starting to be some new gerontology programs and crossovers with social work and gerontology. And it was pretty sparsely populated, but I figured that it was going to bloom as soon as the, as the baby boom gap to where it is now. But it's funny, it doesn't seem like there's as much uptake as I would have expected. So kudos to students who are in this, getting into this field. But I think one question that I have is how do we spread that? I mean, this is such a vibrant, exciting field. It's, totally cross-generational, and, I'm preaching to the choir. You all know why we're here. But, how do we ignite that passion in other future generations? Because we need that. We need people, and fast.
Exactly, Sarah. And that kind of goes on the next question. How can we share this with the overall community? And how can we make sure that our organizations that are serving our seniors and those who are disabled understand these resources and just don't get so bogged down in everyday care that they miss some of this? So does anyone have some ideas of how we can make sure that our communities understand what is available for them?
I mean, I'll just put in a shameless plug for connecting Project Echo and the KCHC with other organizations and inviting them and creating, continuing to expand and increase our network.
Exactly. And yes, I mean, this is so important. When I saw the subject matter, I sent it to some of my people that I work with, and thankfully Misty is one of them that came. So let's think of that when we're hearing about these subjects. How can we get some of our colleagues to be able to learn more? And I'm wondering about in the spring and the summer, we're going to declare that we're going to be healthier and that we're going to be able to get out into our communities. And so can we as organizations make sure that we set up tables at these events and make sure that we are sharing all of this information and you know, being bold, getting out into the roadway and say, you know, I want to talk to you about these things because we are aging. We're all aging, no matter our age, we are aging. And we want to make sure that folks know that there's some wonderful resources for them that not only can help them age in place, but also flourish as they age. And that kind of goes back to our first talk. If we can help people understand the importance of nutrition and how it affects everything, chronic diseases, depression, and just overall ability to feel better so that we can socialize and enjoy each other. Our grandparents, if they could understand as they are healthier, they're going to be able to influence their grandchildren, and that we're all responsible to each one. Eden said at the very beginning of her presentation, it is the community's responsibility. And she went even further toward the end, and she said something to the effect that we are brothers and sisters, and that we can do something about it. And I hope that each of us will leave today first saying to ourselves, what can we do? And then how can we get those that we work with and that we play with and that we go to church with, do something too? And as I think as we come together, that we can see a lot of good things happening in our community. Would anyone like to add to that? Okay, Catherine.
There's another group in Louisville called Triad. I don't know if any of you all have attended that, but that's another great way to get the community information out, not just to the senior providers, but there are actually community members that come to that. And so that would be a great way. And it's also AARP and many others that attend that meeting.
We're part of that. Traeger Institute, we partner with them quite a bit. We're part of that group. Yeah.
Yeah, the Triad is a great group. HSPN is a great, the Aging in Place, somebody just asked me for that information. I was a part of that years ago. I don't know where it stands right now, so I don't have that contact, but they are attending the HSPN and I believe the Triad meetings.
Mm-hmm.
So that would be another way to connect up with the Aging in Place group. I apologize. I don't have direct contact anymore.
Well, maybe we can try to locate that. I don't know if Barbara Justin has any ways to figure that out, but if we figure it out, we will let you know.
I know how to connect with the Aging in Place. So if anybody's interested in that information, we can definitely share it.
Okay, great. Okay, so does anyone have some events coming up that you would like to share?
Yeah, I'd like to talk about the Optimal Aging Conference. The University of Louisville Traeger Institute have been hosting the Optimal Aging Conference for now, I think it's the past 5-6 years, almost, with the exception of 2020 because of the pandemic. We didn't have a conference, but we will be hosting our conference again next April. It will be virtual, and our proposal submission is open. So we want to encourage any and everyone who is interested in presenting the wealth of knowledge and information, program services, interventions, et cetera, that you may have access to. You can definitely go to our website and find the information to submit a proposal.
And we actually do have a slide coming up. And so when you get the slides, you'll have the information in front of you really easily. Okay. Yeah, hint, hint, there's several people on this call who should submit a proposal, or Justin said. I agree wholeheartedly, Justin. Anyone else got something coming up that we should know about?
Well, the US Aging Conference is coming up in July. So that's also, deadline for proposal submission is today. But I know that that Project Echo has come. They were certainly there last year. That's how I heard of you. So you're doing a great job getting the word out there. But I put the link in the chat.
Thank you.
Thank you. Thank you. Okay, so I just want to share some things that's going on through our Traeger Institute. On Monday nights, we have a Zoom meeting. We've been having this since almost the beginning of COVID, maybe the second or third week when I realized it wasn't going to be a temporary thing. I was doing this on a monthly basis prior to COVID, but we started doing it on a weekly basis. And now we have such a following, they won't let us quit. So that's a good problem to have. But we meet every Monday night. It's an educational and support group. We have a guest speaker, and we have a little time just to talk like we're doing now about the topic. And this coming Monday night, we're going to be having open conversation time. And we'll probably be talking a little bit about what we're going to do through the holidays and some ways to enjoy the holidays rather than struggling. But it's really what our people want to talk about. That's what we're going to do. And then our Flourishing Together that you heard me mention earlier is a 10-week, and my goodness, I thought I went in there and changed that, Justin. We also are doing some in person now and some hybrid. So I need to get that in there so everybody knows. But what this is just a way for folks to come together, and they're going to team up in small teams, and they're going to learn easy and practical ways to eat healthier, become more active, and take control of their health conditions. We do look at it from a holistic point of view. We talk about the struggles that we have with food. We talk about the struggles that we have with stress and problem solving. And it's just a healthy lifestyle to prevent and manage our chronic diseases. We've been doing this for a number of years now. And if I had time, I could tell you story after story how folks have changed their lives and are doing so much better. You'll see the Flourish program mentioned up here. This is our, we call it our flagship. That's kind of what got us started with all this. And it's designed to help adults with multiple chronic conditions to improve life satisfaction through a comprehensive care navigation program. And our folks who want to be a part of that program are teamed up with one of our students, and they do a very in detailed assessment. And really, we come together then as a collaborative team. Many folks are represented there and help them know how to become healthier. We do have an excellent caregiver program, and it's designed for those folks who are 60 and above to provide support and resources for that person that is blessed enough to be a caregiver, knowing that even amidst the joy, there is lots of struggles, and we want to help prevent burnout. Our virtual friendly visitor program, Barbara talked about that earlier. And again, we primarily use our students, although we do have some community members, I believe, who've been trained. And this is just to help our people with isolation and loneliness. So if you go on to the next slide, I believe I've got something there to tell you about our upcoming Flourishing Together classes. We have one scheduled in Spencer County at the Extension Office. And we have one scheduled at the University of Louisville. Now, the one at the Extension Office is in person only, but the one at the Traeger Institute will be hybrid. So a person can choose to come in person, or they can choose to come by way of Zoom. I also have one scheduled for the University of Louisville students, University of Louisville employees. So if any of you on here are an employee, you might contact me about that. Okay, so let's go on to the next one. Just to give you an idea of what's going on, I already told you Monday night, we're having the open discussion, and then the following week, we're having a concert with some very good information on music therapy by one of our students. She did this for us last year, so we can attest that it is beautifully done. And so we sure would love to have you on both Monday nights that are left in December. And then we'll be starting in January all over again. And of course, this is the information about the optimal aging that Barbara alluded to. And you will get these slides, so you'll be able to do your proposal. And the proposal has been extended to the 16th. So get it done. We want to hear from some of you. Okay. And that's the dates, April 15th through the 18th. And what I want us to do is to fall into the habit. And I did this for each season this year. We fell into the habit of something, but we're going to fall into the habit of being joyful for December. So as you are thinking about what's coming up, try to put joy to it. And now we're going to do our 1-minute evaluation. And Justin, I'll turn it back to you.
Thank you, Mona. So I am going to launch the poll. So please fill out this session survey. Again, if you would like to receive a certificate for today's session, you do need to fill this out and indicate that you'd like to receive a certificate. And you'll notice on there that 1 is not at all and 5 is a great deal. So just notice that the ranges from 1 to 5 or not applicable. And I hope that you're going to join us in January. When we come back in the new year, we're going to have a conversation around what matters most and an introduction to advanced care planning. And it's going to be an interactive discussion. I will be facilitating that. And then in February, we're going to have a representative from Kentucky Elder Law who will be talking about the importance of elder law for older adults and talking about the clinic that we have here at the Traeger Institute. So I hope you have a safe and happy holiday season and a good new year, and we hope to see you in January. So thank you so much, everybody who's here today. I'm going to go ahead and stop recording. And once you complete your poll, you are free to go.